Well, from fad diets to discouragement, it's tough to stay on track these days when it comes to weight loss. But there's hope for many who once felt hopeless. One expert shows you a plan that can help you stay on track. Well, for some people, it just feels like diet and exercise aren't enough, and we want to let you know that there is help available. Joining me right now is Dr. Schmitt with Alabama Weight Loss Surgery. Thanks so much for joining us. We appreciate it. We've talked in the past about gastric banding, but there's some new procedures out as well.
There are, as you said, diet and exercise are great if you need to lose 5, 10, 15, 20 pounds, but in my patients who are 50, 75, 100 pounds overweight, diet and exercise fail miserably.
We're all built in different ways.
Yep, it's very, very hard to lose weight and keep it off. And surgery is incredibly effective at helping people lose weight and keep it off. We talked about gastric banding and gastric bypass in the past. There's a new operation that really combines, well, has the great benefits of both of those surgeries with even fewer complications, and that's called laparoscopic sleeve gastrectomy.
Okay, and how does that work?
Well, like the other operations, it's done through little small incisions, so the pain is minimal. The patients usually spend a night in the hospital, sometimes two. And in that operation, it's a purely restrictive operation. We remove part of the stomach to leave them a smaller tubular-shaped stomach. So when patients eat, they eat smaller amounts. That's what a gastric band does. You eat smaller amounts and you feel full. Gastric bypass, you eat smaller amounts and feel full, but you don't have a foreign body in, you don't have the gastric band, you don't have to come in for adjustments. With gastric bypass, the biggest complication, which happens about 5% of patients, is ulcers at the area of the connection between the stomach and the intestine. And you don't have that with sleeve gastrectomy. It's simple. You just remove a portion of the stomach vertically and remove it from the body. And patients do extremely well. Of
course, everybody wants to know how effective this is, and we do have some before and after photos.
Great.
We can talk about these.
Well, you know, the average person will lose about 60% of their excess weight and keep it off. So patients won't get skinny. Some people will. Maybe about 20% of patients will not lose the weight they want to lose.
But diet and exercise still need to play into this, right?
Patients still have to diet, Wendy. They still have to diet the rest of their life. That means you can't have these operations and go and eat cookies and ice cream and pizza and eat out and eat French fries every day. These patients are eating meat and vegetables and salads, healthy foods, like you would if you were doing Weight Watchers. Except when you're on Weight Watchers, it's very hard to eat that small portion and feel full and stick with it. And that's why people have a hard time living on Weight Watchers for the rest of their life. When you have a tool like sleeve gastrectomy, you eat that small amount and you do feel full.
So what kind of results? You started to say they usually lose about 60%.
About 60% of the excess weight. So, you know, women who are 250 pounds and need to weigh 150, the average patient won't lose 100 pounds, but they'll lose 60, 65 pounds. That's average. We have had patients lose 100 pounds.
Is this more or less effective than, say, some of the other methods like the gastric banding?
That's a great question. That is as effective as gastric bypass, which is a kind of a more invasive operation. Not as effective, more as effective as gastric bypass. Gastric banding is not as effective as gastric sleeve gastrectomy. Sleeve gastrectomy is better weight loss than gastric banding. Gastric banding, people lose about half.
And so 50%. Basically everything needs to be recommended per person. They need to come in
we
and
make
talk
the decision
to you.
with them. Some patients say, I don't want to have gastric bypass. They've heard horror stories in the past. The facts are, with gastric bypass, it is as safe as having your gallbladder removed.
Right, wow.
It is.
Are there any risks involved for this newer procedure?
There are risks with all operations. You know, so far, the complication rate has been incredibly low. I mean, I haven't had any major complications. And that's one reason I like it so much. You know, I'm not having patients come back with an ulcer. I'm not having patients come in with, you know, abdominal pain or a slipped band or wound infections. It's been a very satisfying operation.
I would imagine that you have a lot of patients come to you and say, why didn't I do this sooner?
Just about all of them do. And I see patients that I've seen a couple of years ago that decided not to have surgery for whatever reason. Perhaps they didn't have insurance coverage. And insurance covers gastric banding and gastric bypass. Sleeve gastrectomy is a newer operation. Blue Cross Blue Shield Federal, so people who work for Social Security, you know, and federal agencies, people with Blue Cross Blue Shield Federal do have coverage for it. Aetna announced last week they cover sleeve gastrectomy.
So it's still being...
Otherwise, it's an operation patients have to pay for on their own. So a lot of patients, you know, will go ahead and have gastric banding or gastric bypass instead.
Most important thing, though, they need to see a doctor. Of course, Alabama Weight Loss Surgery.
They need to get educated about it. We have seminars twice a month, free.
Good.
come see us, and we'll talk to you about it for an hour and a half at the seminar. You can meet patients and hear everything you need to hear, including the risk and complications.
What's your website so people can learn more?
www.alabamawls.com.
All right. Well, thank you so much, Dr. Lee Schmitt. We appreciate it. It's just fascinating, all the new developments.
Thank you.
Thank you.